Good afternoon. Since Wednesday, April the 22nd, we have seen a 23% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 1,977 reported cases, 393 people hospitalized with COVID-19, and 80 deaths. We are focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in the city of Baltimore. Over the last few weeks, we have stood up a new call center staffed by healthcare professionals to provide residents with the most up-to-date and accurate information. We have also launched a dashboard to provide residents with essential information around this pandemic. We rolled out a broad-reaching advertising campaign. Last week, we launched the COVID-19 Small Business Assistant Initiative and the COVID-19 Small Business Task Force, which represent the first steps of many in Baltimore's continued recovery and eventual reopening. We also launched 2 new testing sites last week, the Rollins Conservatory at Drew Hill Park and Lake Clifton Park. All of this in an effort to provide residents with the needed resources and to help keep them informed as we progress through this public health emergency. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptoms screening and to be connected to a physician for assessment. Today, we are launching our expanded dashboard for residents to take advantage of. The new dashboard can be found at the top of coronavirus.baltimorecity.gov, and that's coronavirus.baltimorecity.gov. We have incorporated racial, gender, and age demographics, as well as testing site information and food access information. Another new feature on this page is the live chat option, which can be found in the lower right-hand corner. Now residents who have questions have another avenue to seek verified information. I hope all residents make use of these important tools. I know I probably sound like a broken record because I keep saying the same message every week, but it's that important. We need everyone to stay home unless you need to go out for essential reason. And I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. You have literally saved lives. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. And we're asking your help in minimizing your contact with hospitals and healthcare facilities during this difficult time. Every time you leave your house, you put yourself and everyone in your household at risk. Now I will ask Baltimore City Health Commissioner Letitia Zarasa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to all of our partners across agencies and in the private sector for all the work you've been doing as a part of the Baltimore City Coordinated Coronavirus Response. Today, I am pleased to announce that we have updated our COVID-19 case count dashboard, which, as Mayor Young mentioned, can be found at coronavirus.baltimorecity.gov. The updated dashboard now includes a set of new data points that are critical to Baltimore City's coordinated response to the COVID-19 pandemic. Our approach to this pandemic has been rooted in transparency and data sharing to allow the health department and our partners make informed decisions about new testing locations, staff capacity, and our gradual recovery as a city and health system. In addition to updated maps of positive cases in Baltimore City, the updates to the COVID-19 dashboard include data for hospital equipment being used, including the number of ventilators, the number of patients in intensive care and acute care units, the number of COVID-19 tests issued in Baltimore City, including positive and negative results, the number of individuals currently in city-supported isolation sites, and the number of meals distributed as a part of the city's emergency food relief efforts. Again, all of this information is now publicly available at coronavirus.baltimorecity.gov, and the data will be used to ensure that our pandemic response is equitable across geographic and demographic lines. Nursing homes and other long-term care facilities remain a top priority of the Baltimore City Health Department as a part of our response. We know that outbreaks of infectious diseases, including coronavirus, in nursing facilities and other spaces where multiple people live and interact with one another are common. We also know that older adults remain at risk for developing serious coronavirus illness. Moving forward, the Baltimore City COVID-19 dashboard will provide a listing of the aggregate number of cases in all nursing homes in Baltimore City and the fatalities that have occurred in those facilities. Additionally, as was announced yesterday, the Maryland Department of Health will also publish a list of congregate living facilities, including nursing homes, assisted living facilities, state and local facilities, and group homes with 10 or more occupants that have confirmed COVID-19 cases to their website, coronavirus.maryland.gov. This list will include the facility name, jurisdiction, number of cases, and number of deaths, and will be updated weekly. To date, Baltimore City, along with partners in the private sector, have set up 3 community-based testing sites at the Pimlico Racetrack, at Druid Hill Park in front of the Rawlings Conservatory, and at Clifton Park at 2801 St. Lo Drive. As of yesterday evening, the city, in conjunction with our hospital partner LifeBridge and the Maryland Department of Health, have tested more than 1,300 city residents since the launch of the first city-supported testing site at Pimlico on April 10th. Each of these sites still requires a physician referral and a previously scheduled appointment for residents to receive access to testing, and both the Druid Hill and Clifton Park locations have a walk-through protocol for those without access to a vehicle. These community sites allow residents to receive access to COVID-19 testing closer to home and will help alleviate strain on our hospital systems and clinics that are also operating testing sites. Residents without a primary care provider can contact 211 for coronavirus symptom assessment or to speak with a medical professional. We look forward to announcing additional testing sites in the days and weeks to come. Finally, local area hospitals are still reporting a decline in patients seeking urgent care for heart attacks and stroke symptoms. I would echo what Mayor Young said, that for mild concerns or complaints, please stay home. However, for major concerns, we want to re-emphasize that these will not go away on their own, but instead can result in very severe complications and even death if not treated in a timely manner. It is extremely important that while residents continue to practice social distancing and stay at home except for essential reasons, if you are experiencing severe symptoms of any kind, please reach out to your doctor as soon as possible or call 911. Hospitals remain available to evaluate and treat patients suffering from acute life-threatening diseases. While we understand the concerns about being treated at a hospital with other sick patients, hospitals have taken the precautions to protect patients, including isolation wards, infection control measures, and separate entrances to ensure that patients with coronavirus symptoms are able to be seen and treated safely. Do not wait if you are experiencing any of these life-threatening symptoms. Please seek care immediately. Thank you.
Thank you, Dr. Savasa. Before we take questions, I'd like to, first of all, thank all of our first responders. I'd like to thank our, healthcare workers who are putting their lives on the line. I want to thank our National Guards that are out here helping and assisting us in the work that we're trying to do to slow the curve. Our sanitation workers, our police officers, our firefighters, even you, the news media, for covering and putting out the information that our residents need to get. So I want to thank everybody for doing their part. But most importantly, I want to thank those Baltimore City residents that are paying attention and are staying home and are practicing social distancing because it's really important for us to slow the curve. So with that, we'll take a few questions.
Can we just reiterate on the issue of the hospital, of going to the hospital, which is obviously caused a lot of concern from a lot of people, then they aren't going. So what should people, just to reiterate, what people should do if they are experiencing health issues that might require hospitalization?
I mean, I could take it, but I'll let you go ahead. I can take it.
So, I mean, ideally, again, they're reaching out to their primary care provider. Of course, if it's an acute emergency, then they should be seen at a hospital. They should call 911. So we want people who are experiencing anything that's life-threatening, severe chest pain, shortness of breath that is severe, difficulty catching your breath, turning blue in your lips, your fingertips. Those are reasons to seek care at a hospital.
And not to shy away from it?
Yes, do not shy away for those severe life-threatening symptoms.
You talked about the preparations and the accommodations that hospitals have made to try to make it safe for everybody. Can people be confident in that?
I think, I would rather them not risk being at home and having severe symptoms. I would rather them seek care. Certainly, our hospitals have taken great lengths to provide appropriate infection control, but certainly anytime we go out, there's always a risk with community transmission. So I'd rather, though, that someone go and go to the ED if they're experiencing those life-threatening symptoms.
It looked like from the dashboard about a fourth of deaths are in nursing homes. Can you provide more of a breakdown of if those are clustered in one or the whole homes, or just elaborate on what that means for the city?
Yeah, so I think Maryland's website will have it broken down by facility. We're keeping it more broad and including those deaths in nursing homes in general, but I think the Maryland website will have that information.
Is there anything about the data that, I don't want to say surprises you, but is of particular interest as you collate this kind of data?
So we were always looking at this data. I think we've now made it much more public and available for the public to see. But I mean, I think this echoes and reflects certainly what we're seeing across the country with greater disparities with African Americans carrying the high disease burden, with African Americans having higher fatality rates. Certainly seeing that nursing homes are also an area where we can see COVID-19 spread very easily in congregate settings in general.
It looked like you could see in the dashboard certain zip codes that had a higher percentage positive than negative. Clicking through it quickly, it looked like some had as high as like 60% positive. What's happening in those areas that makes it so different from the citywide average of like 20%?
Yeah, and I think that certainly could be related to testing discrepancies as far as who gets selected to actually go for testing. So certainly there's general criteria that's been put out by the CDC around prioritization. So that is something that we will look more closely at, but I don't know that we have the exact answer yet.
Are you noticing discrepancies in testing in terms of race, age? Just kind of what are you seeing there?
I mean, I think testing is still not very widely accessible. So I think for us, it's just focusing on how do we make it much more accessible across all demographics, but recognizing that there are some zip codes that we've noted that does have a higher disease burden. So that's kind of how we're driving our decision making and making sure that we're testing in those sites in particular. And again, going back to our 2 sites that now have walk-up capabilities. We want testing to be accessible to people who don't have transportation.
Anything else, guys?
This might be a question for you, Mayor, or maybe even Commissioner Henson. Are we seeing that these numbers are actually going down? Like, are people staying off the roads? Are they taking this seriously? Is crime down? Are just numbers of people being out and about down in the city?
I would say the majority of the citizens, like I said earlier, are, paying attention and following the direction that we have laid out, our health professionals have laid out. However, we still have a segment of the population that's still out there doing what they do, like you mentioned, crime. And we're working very hard. The commissioner is working very hard to make sure that our officers are out and engaging and trying to prevent that, but I'll let him speak to that.
As the mayor said, there are some people who are out going about their business of finding necessary essentials, going to work, those who have essential jobs. What we're seeing is a significant decrease in the calls for service from citizens for police to respond to things. And with that, we're seeing some decreases in some violent crime, but we're seeing significant decreases in property crimes. So there is some correlation between the amount of people who are out and the call volume of calls that we're actually going on. Right?
Can we ask the health commissioner one more question, just to clarify something she said about going forward, the dashboard is going to include, is that a per facility count?
No, I was saying Maryland's dashboard is actually going to be listing the facilities.